All right. Okay. Can you guys hear me okay? Okay. Well, so let's get started. Good afternoon, everyone. I know that we had a lot of people registered in person, so we might have more people joining us. But in the interest of time, let's get started. Um, Thank you all for coming today, and we have a lot of folks joining online as well. My name is Jay Lee. I am a professor in residence in the Department of Psychiatry. And here at DGSOM, I co-lead the Health Equity and Translational Social Science research team, along with my colleague, Dr. Alma Guerrero from Pediatrics. And today it gives me real joy, and it's a tremendous honor to introduce one of my colleagues, Dr. Crystal Lee. And before I begin, I wanted to share some words about Dr. Crystal Lee. Dr. Crystal Lee was born and raised on the Navajo Nation, and her tribal clans, out of respect, I'm going to say the tribal clans in English. So her tribal clans are Red Running into the Water, Water's Edge, Cliff Dwellers, and Red House. And in terms of her education, she completed her undergrad education degree in Arizona State University. She got her MPH and PhD in public health at University of Las Vegas, Nevada, MLS in Indigenous People Law at University of Oklahoma College of Law, pre-doctoral fellowship at Johns Hopkins University, and here at UCLA, she completed her NIMH T32 postdoctoral fellowship. She currently serves as the assistant professor at University of New Mexico College of Population Health, and she is an Indigenous HIV/AIDS research training fellow at University of Washington Indigenous Wellness Research Institute. In terms of her research, she conducts biomedical prevention research with a focus on Native American health and examines Indigenous health policies at multiple levels. She is a proud founder and CEO of United Natives, a nonprofit organization that serves the Indian country on multiple initiatives. She's also a founder and CEO of Dr. B Collection, a Native American fashion line, and she's sporting one of her creations today. She is also the owner of two men's professional basketball teams in Mexico, Rosarito Sun and Tecate Magic. And her organization, United Natives, was featured as one of the USA Today's top nonprofit organizations addressing COVID-19 in Indian country nationwide. In terms of her advocacy and policy work, she serves as the vice chair for the Clark County, Nevada Democratic Party Native Council, advisor for the Nevada Office of Minority Health and Equity, and United Nations North American Indigenous Caucus, UN Indigenous Women's Caucus, UN Gender Equality Task Force. She served as a tribal health advisor to the Obama administration and was honored by President Bill Clinton for her work with Indigenous communities at the Clinton Global Initiative. She also serves as the board chair for the Las Vegas Indian Center, board director of diversity and inclusion for L'Oreal USA, and partnered with NFL Alumni Association for the Super Bowl. She was the 12th class of the National Center for American Indian Enterprise Development's 40s Under 40 Award. So such a plethora of accomplishment. And one thing I really appreciate about Dr. Crystal Lee is she is able to do her research not in the traditional research setting, but really in collaboration with her communities. And it's really inspiring to see. And I think on a personal note, I firmly believe that we're shaped by the people we meet along the way. And I got to know Dr. Crystal Lee while she was a postdoctoral fellow here at UCLA. And she's one of those people that really shaped the way I approach my work. And to be honest, I think her experience here as a postdoctoral fellow was not completely nurturing or supportive, but I am proud to say that she persevered and she was gracious enough to stay in touch, and we still collaborate on multiple projects. So it is my great honor, super happy to welcome her back to UCLA as CTSI Distinguished Speaker. So please help me welcoming back Dr. Crystal Lee. So before we get started, I think Dr. Lee wanted to share the video that she wanted to highlight, and then we can have her come up.
There was a lot of death. Every single day, I knew of someone that had passed from COVID. And that does something to you because that's your family, that's your community. Hi, Grandma. In a way, you almost feel self-defeated. Like, how do I help?
That time I was okay. Next day I'm okay. Yesterday evening, he really hit me. It was really hurting on the side. Hurt.
Mentally and emotionally, it definitely impacted me. Sorry. No, I was just thinking about my uncle who passed, and I grew up with him. He was closer to my age, although he was my dad's youngest brother, but we grew up together. And it hurts, for sure.
Tonight, I'm gonna have myself a real good time. I feel alive.
The Navajo Nation is the size of West Virginia, but yet there's only 13 grocery stores that lie within the reservation. How do you tell a community in the United States that has no running water or electricity to wash their hands? Do they have the financial means to get gas to go to a hospital or clinic? Housing is overcrowded within and among Navajo households. And then you talk about pre-existing health conditions, chronic diseases, also other infectious diseases. And in combination with the outbreak of COVID, it really hit our community extremely hard. My name is Dr. Crystal Lee. First and foremost, I'm a scientist/academic. Both my maternal and my paternal grandfathers were Navajo medicine men. I was 8 years old and in a ceremony watching my grandpa pray for someone. And I remember sitting there in the ceremony and I thought, wow, that's what I want to do with my life. I want to become a doctor and I want to help my people. At the institutions I have been at, I was usually the first Native to graduate. I wanted to see how I can integrate policy with all this health and science because health policy is such a huge factor on making change. I actually made a recommendation at the United Nations Permanent Forum on Indigenous Issues back in 2018. One of my primary recommendations was they improve international health policies in the event if a pandemic occurred, acknowledging that Indigenous populations globally would be the most adversely impacted. Now you bring us to 2020 when COVID hit the Navajo Nation. My hypothesis was absolutely correct. Historical trauma in our communities has been such a deep and heavy issue for us Native Americans, Alaska Natives, Indigenous people of this land. It was very purposeful to expose us to infectious diseases as a way to commit genocide. And that purposeful act, along with multiple acts, still impacts our health and well-being.
We're just something odd dollars a person. It's not enough to provide services in terms of food.
For example, when the first round of federal funding came out to assist states to combat COVID, tribes were not included in the first round of federal funding at all.
I hoping I get a different answer, but I talked with him and so the monies are pretty well spoken.
A big reason why our points of care and our Indian health service system is so substandard is because we get discretionary funds at the congressional level. We are the last to get funded and the first to get cut. That was a huge layer of why it took our tribal communities longer time to react, because we literally did not have the fiscal resources. Part of my academic training is infectious disease and preventative medicine. And when the virus first came out, I understood how the virus was most likely an airborne virus. My nonprofit, United Natives, was the one who spearheaded all of the COVID-19 initial efforts in 2020. And with that, I made some culturally responsive recommendations. For example, as Natives, we burn sage, cedar, and/or sweetgrass. There has been scientific knowledge that if you burn any one of those, sage, sweetgrass, or cedar, that what happens is the smoke weighs down the particles in the air and it falls to the ground. It doesn't kill the virus, but it weighs it down, so it's no longer lingering as airborne. So part of my recommendation to our Native community was, if you had someone in the household that's coughing that you think might have contracted COVID, let's resort back to some cultural preventative practices. Again, there was no scientific knowledge that it worked with COVID, but at least we could try our best to implement some prevention strategies that were cultural based. In addition to that, we delivered masks, Lysol products in total to about 70 different tribal communities. We partnered with another company temporarily to quarantine Native people. We would pick them up and we secured an entire hotel with over 100 rooms. In March, April, and May, our hotel rooms were completely occupied by people who were COVID positive. Out of the thousands of people we quarantined, only one passed from COVID. And as a result of our quarantine phase, a huge observation was our community members verbalizing that my 14-day quarantine phase is done, I'm COVID negative, but yet I don't have a home to go back to. I don't have a job, I don't have food. I'm a female that's a victim of domestic violence. I don't want to go back home because I'm getting abused, myself and my children are not safe. There was a huge increase in substance abuse, a huge increase in domestic violence, especially among our Native women. And we knew that we had to come up with a plan very quickly. So we ended up turning that hotel into a mental behavioral health facility because of the need. As a result, I started my own company, again out of need, which is called Indigenous Health. And we do everything from medical health services to mental behavioral health. We opened our doors January 10th of 2022, and Indigenous Health started as a mental behavioral health company to address the gap in need. We have Native American clinicians on our team, and we have evolved into a nationwide company now providing services for the urban natives in Baltimore, Maryland, Washington, D.C., Boston, Massachusetts. We will soon be in New York City, in Chicago, Illinois, in Los Angeles. And we find that these efforts really help our Native community, especially those that are dealing with mental behavioral health issues. and I want to bridge the gap of access to care and quality of care. But not only that, I want to help with bringing culture and our indigenous ways of health and healing and combine it with Western medicine to help our people. What we're doing now, peer support. You know, you've excelled this long in this program. Now you feel that you're able to help your other peers who are incoming to the program, maybe the newer ones.
I have so many ideas, so many things that I want to do for my people, for myself, for my kid. I want to open a business. I want to do cosmetology school. I want to work here. I want to, you know, like, I want to learn to pray.
Native Americans, Alaska Native people do not have health equity, and I do not believe that we will achieve it in my lifetime. However, we can make strides to get there. I had that vision at 8 years old, and for me to be able to live my vision and live my dream, to honor what my grandparents had prayed for, what my ancestors survived, for me to be here in 2022 as a Navajo woman, as a doctor, and to truly give back and help my community. I just really hope my ancestors are proud. I can think of my grandpa, and my grandma is looking down and saying, "This is what we prayed for," and we're really proud of her.
Good morning. Or, sorry, good afternoon. And happy Valentine's Day. Um, kind of heavy and emotional to start off the presentation, but I just wanted to say welcome, and I'm honored to be here. Thank you, Dr. J. Lee, for everything that for your mentorship and for being a colleague currently. Just to go ahead and quickly introduce myself. Yat Dr. Crystal Nishia. Hi, my name is Dr. Crystal Lee. Tisto, Arizona, Ede Nasha. I'm originally from a very, very small community called Tisto, Arizona. My clans and my language are Nata de Ne'et Tachi Nishle, Nanish Ejatambaha Bashishin, Senja Kinadashache, Kinslachi Dashanella. And also acknowledging the homelands of the original people of this homeland as well. And so there's so much. I'm filled with so much emotion right now for multiple reasons. First and foremost, I felt surreal coming back here to UCLA. I completed my postdoc here from 2016 to 2018 at David Geffen School of Medicine, and working with Dr. Lee here. And I just wanted to be truthful about my experience here and genuine as a Native American person, as a Native female. We experience so much. And growing up on the reservation is unlike growing up anywhere in the United States. It's like living in a country within a country. We face a lot of disparities, even down to the basic unmet needs of running water and electricity. And with that, I have incurred a lot of challenges, just like my fellow Native Americans do. We face a lot of discrimination, a lot of racism, a lot of gender discrimination, sexual discrimination. And growing up on the res, I fortunately had a father who you saw in my video, and my father just passed a few months ago. And growing up, my dad would always tell me, you're gonna have it 10 times harder than anybody else because you are a female and because you are Native American. So it's my job to make you strong, to make you tough, because when you leave the res and you go face the real world, I can't always be there to protect you. So it's my job as your father to teach you things, to prepare you for the life that you're gonna face, both good and bad. And he was right. And when I came here to UCLA, unfortunately, I faced discrimination. I was the first Native American ever to work in that department, and there was a lot of clash. I was misunderstood in so many ways because of how I was raised. I was raised, community comes first. Culture should always be sustainable. I was raised that the people's voices should be heard and represented. And which was a clash to current day research, right? We want data, we just want to go, go, go. We don't really see the people's lives that we're impacting. We don't feel it, we don't hear it, we don't touch it. We're locked away in an office, writing grants, publishing. But then there's a huge disconnect along those research processes. And that was a big struggle for me here because I come from the community. I just don't leave and stay away and then only come back when it's convenient. We see the issues that our communities face. I hear it on the phone every day when my relatives call. Your relative's sick, your grandma's sick, your cousin's sick. All these issues. And in a way here, I felt truly isolated because I did not feel understood on my research practice, on who I am as an individual, on my value system, and bringing that into an institution where productivity is the most valued and productivity is what needs to be done. There was a huge disconnect my first year here. I was even told by a senior faculty that I did not belong here at UCLA. Literally, those words came out of her mouth. They told me, you do not belong here. You took the position of someone else who's more deserving for them to be here instead of you. I cried my first year here almost every week, crying to my mother saying, I just want to leave. I don't feel accepted. I feel like I'm a circle and trying to fit myself in this square box and it's not fitting. And I felt frustrated and I felt not capable. I felt not intelligent. I felt just all these negative feelings and I questioned myself. I questioned my position here. I questioned my ability to be here. And my year one was very challenging. But my mom told me, you have to stay because I promise you, you're going to learn something. It's going to strengthen you and you're going to gain something regardless of how you're being treated. And then there was an epiphany that happened here. And I'm thinking, why am I trying to make myself fit into something that obviously doesn't fit? Why do I keep trying to conform? And that's just not me. And then like a light bulb went off. And I said, I can never conform because that's not who I am. That's not how I was raised. I'm first and foremost a Navajo woman. And that is who I am. I'm not a researcher. I'm not a scientist. I'm not a doctor. I'm a Navajo female that just happens to have went to school and does these things. So with that enlightenment, I thought my worldview should be celebrated, not looked down upon because of the uniqueness that we possess. Our vision, our philosophy, our practice as Native Americans, as Indigenous people, it should be celebrated and it should be something that we as an academic institution, that we should celebrate all people and what they bring to the table, all cultures, language, how people grew up. That should be, that makes up a collective and efficient outcome in our workspaces. And so I had this mindset, like, I'm a Navajo, I see the world differently. And you know what? I'm going to do my research in that way. I'm no longer going to listen to how I should be, how it should be done, and what process. And I took that and I flipped it. And at that point, Dr. J. Lee became my primary mentor. And I felt like a big relief come from me having a light bulb in my head, and also being supported by a mentor in the vision that I had for research. And so I really come to the table because this is a part of our journey. It's a part of the testimony. We're all here and trying to do something good for the world. We're trying to do something to bring health equity to the world. And that this is just a part of my journey on how my process started. And I just really wanted to relay that message of be proud to be who you are. And I love dressing like this. I love dressing me. There was a time when I felt I had to conform. There was a time where I felt unsafe to dress how I wanted to dress, unsafe to speak how I wanted to speak, unsafe to practice research how I wanted to practice research. And as Native people, that's a traumatizing space to fill in, because as Native Americans, we were not allowed to practice our language or our culture or anything in our spiritual and our faith until 1978. Anything before 1978, which was the American Indian Freedom and Religious Act, we were jailed or imprisoned for just being who we are, for just existing and wanted to practice our faith, our ability to be Native, our culture. And so for far too long, we have been held back. And so now I'm really proud to stand here and say I am genuinely my authentic self in every space, whether it's professional, whether it's back home. But this is a part of me that has made me successful now. This part of me has made me accomplish all the things that I'm going to talk about, because you almost have to be unapologetically yourself so people can understand your vision and what you bring to the table. So I just wanted to say that much. And when I have one of my relatives here, Arvin Sosi. We grew up together. He works here now at UCLA. So his mom and my grandma that you just saw in the video are sisters. And so we're closely related, and I just wanted to acknowledge him as my family member here. And so, and he was also one of my light when I was here at UCLA to help me get through some of the challenges. Here we are looking at part of my Navajo community that we don't have access to running water. And this is how some of us get water. And while I was here at UCLA, I was asked one time, because I wrote a scientific paper that I wanted to publish, and I went to my advisor and just red marks, red marks, red marks. She said, "Where did you get your academic training?" Implying that my scientific writing was basically trash. But I had to sit back and reflect on the question, where did you get your academic training? Well, I started off getting my academic training from the reservation. From the Navajo Nation is where I grew up. That's where I started my kindergarten moving forward. And then understanding the educational disparities that we face as Natives. We're already way far behind the bar from mainstream Americans who get access and opportunities to all these resources within an academic institution. And so that question that she posed to me was really heartfelt because I didn't start off in a great school. I didn't even start off going to a university. I started off at a junior college by playing basketball. And basketball was actually the thing that got me away and out of the reservation to start my educational career. Whereas my colleagues at the time, they started off at the Ivy League schools, they started off at the Johns Hopkins, like the Oxfords, at the Harvards, and here I am, just a little res kid that started off at a junior college playing college basketball. And so my journey has been very distinct and different than a lot of people that I have come across currently in my professional world. Just to give a little background, just to briefly go through this, but our population and demographics has increased. Majority of our people do live in urban settings. Actually, Los Angeles County has the highest number of Native Americans in an urban population, and the second is New York City. So you are surrounded by a lot of natives in LA County as well. Poverty rate is very apparent. We have the highest poverty rate out of any racial ethnic group in the US. And we also have the lowest, of course, income that's parallel and associated. As you can see the numbers here. Because there's not a lot of opportunities on the reservation, it's really, really hard to build economic development. A lot of people don't know, but reservation land does not necessarily belong to us Native Americans. What that means is it's still federal land that belongs to the US federal government, but it's held in trust by the government on behalf for us natives. So we don't actually own the land. And so with us not owning the land, we're still monitored and overseen highly by the US government. That it's really hard to build economic development because we have to go through all these approval processes to build an economic, sustainable, and efficient infrastructure in this realm. So there's a lot of red tape associated with building that on tribal lands. Hence why our unemployment rates and our poverty rates are extremely high. Educational system. It takes for every 100 natives, only 7 attain a bachelor's degree. And I think I heard somewhere that only 1 out of every 500 native persons receives a PhD or equivalent professional degree. The dropout rate is extremely high at 237%. Statistically, we are among all racial ethnic groups, we have the highest high school dropout rates as well. And then, of course, our health status is why a big reason why we're here today is we all want to achieve health equity for populations across the board. And it's hard for us to achieve that equity if we don't really understand the communities that we're working with. And so as Native people, we have the highest rates of diabetes in the world. From the Gila River Nation, I think about 90% of their population, even down to their youth, have diabetes, both type 1 and type 2, and some even have a hybrid. And so we look at the suicide rates. Our Native American youth have the highest rates of suicide out of any racial ethnic group in the US. Native American women like myself, we have the highest rates of homicide and the highest rates of incarceration rates amongst any racial ethnic group in the US. Native women, we are not only do we have the highest homicide rates, but we also have the highest rates of sexual assault, of stalking, and also physical assault out of any racial ethnic group. So we're looking at all these configurations of all these disparities. And the thing about it is not a lot of people know, because our population is extremely small in comparison, and we don't always have the representation. I know when I'm out and about, people freak out that I'm full-blooded Navajo. They've never met a Native American person before in their life. So it comes back also to representation and visibility to bring our issues to the forefront. I'm just gonna quickly go over some quick research because we're all academics here as well. So I'm just gonna briefly touch on some research. So we did this study, more recent, working with Native American college students and looking at biomedical HIV prevention strategies. And here's our research team. We're funded by Gilead, and Dr. Jay Lee was on our research team as well. So we have finished the study, and we're in the publication stage now. The reason why HIV, we chose this is just because of the new HIV diagnoses cases that are very prevalent in our tribal communities. And also because of different substance abuse issues, a lot of our Native women are now contracting HIV at higher rates because of injection drug use, which is even more, has increased since COVID to deal with a lot of the trauma and the grief that has been associated with COVID. So I really wanted to talk about a quick part of our methodology. My nonprofit has a youth council, and so these are recognized 4 of our youth council members who help with the study. And one thing I would just love to say about our study is we had to complete 300 surveys. Now, mind you, our surveys were about 30 to 45 minutes to complete. It was about 30 pages long. So it wasn't just a quick survey. It was a lengthy survey, and we incorporated all elements of culture, of community, of language, of spirituality, of preference of practitioners, whether they wanted to use traditional medicine versus Western medicine. So it was a very lengthy survey. And I think one of the most proudest things I am proud about is 300 surveys, 30 pages long for the survey, 30, 45 minutes to complete one survey, that we had completed all of our survey data within 7 days. The minute we put it out on the internet for folks to complete the survey, we collected 304 total completed surveys in 7 days, which is, we tell researchers like, oh my gosh. But that's because of the community, because our nonprofit works in community. We work with interns who work in the community. So we had no problems getting the data that we needed for our research. Just some key findings from our study. Straight females were likely to know more than any other in our group. Younger respondents knew more. Those that came from tribal colleges, institutions versus mainstream knew less about HIV. Those that were closely connected to their culture and valued the culture and community had more safeguard practices for practicing unsafe sex. And so these were just some key findings. Our survey was so big that we're still analyzing the data, but I just wanted to quickly talk about our research before I get into the more fun things here. The references. So how many of you here do research? Okay. So give me one of the positive things that you like about research. Be your voice for the voices sometimes. Perfect. What is one of the negative things that you feel we could improve on research? Pros, cons, balance.
Communication. I think there's a gap in what we find and what actually fits the population that we're trying to build.
Okay. Great. So what the 2 answers I get pros and cons, to me, comes back down to the people. Trying to be a voice for the people, trying to get across the messaging to the people, the populations that we're serving. Do we all think research is doing a good job in doing those things? Honestly? Sometimes? Okay. And I wanted to pose these questions because I also had to do a lot of reflection for me as a researcher. How am I truly making change with understanding that from research to community translation takes 8+ years to get back into the community? And my people need help now. Like my grandma needs to go to the hospital now. My people need access to quality of care now. We cannot wait for research to transpire and translate and then be implemented and executed in the communities. We just cannot afford to wait because our people need help as we speak. And so with that thought, you know, I myself, I got really tired of waiting. You know, as Native people who wait for help, we'll be waiting for a long time because no one's going to come out there and just help us. And so I started my own initiatives because, like other people, that comes from the community. So I don't lead with I'm a researcher. I lead with I'm a Navajo person that comes from the community first. So I myself is also encompassed in this disparate sector of my community. I'm not separated. I'm in and with among my fellow community members. And so when COVID hit, we had a contract with Lysol. We had a whole warehouse in Flagstaff, Arizona, and we had hundreds and hundreds of pallets of Lysol. And so you could just see a picture of how much Lysol products that we allocated and how much we disseminated. We did a lot of dissemination over so many communities among the Navajo Nation, the Hopi Nation, the Apache Nations in Arizona and New Mexico. When I say public health, grassroots, dirt roads, right? Because some of the most rural communities of the Navajo Nation, it's all dirt road. And there's no paved roads. You're driving for hours in the middle of nowhere. So it was me and my volunteer, and I'm driving this big old U-Haul, and then and then all the way to the middle of nowhere, and for us to unload all the products, it was a lot of work, and we didn't always have a lot of help because it was COVID. Not a lot of people felt comfortable going out, which is well understood. But I'm talking about nitty-gritty, grassroots, public health, boots on the ground work, and we helped. And this is the thing, when our communities needed help, because there's only 13 grocery stores, we don't have access to a lot of other outlets to purchase. We're not in the cities where you could just go down the street and get masks. Like we had literally limited access to every type of resource that we needed at the time of COVID. Now, I'm going to segue into the advocacy piece because visibility, representation, the voice is needed. I've been working with the United Nations since my 20s. I was a former co-chair for the Global United Nations Indigenous Youth Caucus. And within my tenure of that position, what we did was we worked with Indigenous youth globally, and we fought for representation to be advocates of our own issues as being youth. And we also helped to develop and implement international policies that gave us stronger voices at the table when it comes to strengthening international health policies. So with my work with the UN, I do a lot of advocacy on human rights issues, especially as it relates to Indigenous populations globally at the global level. One thing my nonprofit does do is we're a local to global. Of course, we focus on our tribal communities here, in the US, but we also work in partnership with global Indigenous communities from all over the world, South America, Asia, Africa, and we're considered North America. So I am proud to say that we have a brotherhood, a sisterhood with other Indigenous communities, and that we're all fighting the good fight in terms of building awareness. Now, who is a football fan? Only 4? 5? Okay, who watches UCLA football? Okay. Well, would you happen to know who this young man is? No? Come on, okay, I'm so disappointed. He was your starting quarterback for UCLA football team for the past 5 years. Dorian Thompson Robinson, DTR, ring a bell. Okay. So this is Dorian. He played for 5 years, including COVID year for UCLA. This past year, he just got drafted to the Cleveland Browns. So it's his first year in the NFL as the backup quarterback for the Browns. So he's here. Oh my gosh, one of your running backs, Zach Charbonnet, you remember him? He was nominated for a Heisman. Okay, this is Zach Charbonnet. He also played for UCLA. Titus, he currently plays, he just finished his senior year. And then here's Jake Bobo, who also transferred from Duke, played for UCLA. So now Jake is currently at Seattle Seahawks. Dorian is Cleveland Browns. And then Zach is at Seattle Seahawks, and he just finished. So I say that to say, our nonprofit is really making waves in the sports world because we need more resources, and to bring professional athletes into this space to motivate and help elevate our Native youth is a large part of the work that we do. So we hosted a free football camp, and then of course wanted to recognize the UCLA players, and in Mesa, Arizona, and we had about 200 Native youth attend our football camp. And so this is the aspect, in a way it's research because it's community building, and it's building the trajectory of our youth by not doing a normal traditional research route. I just told you that it took me 7 days to collect 304 completed surveys. And it's not because I'm a great researcher, and it's not because, I publish all these things. It has everything to do with what we do with the community work. And that is the foundation, is the community. And for us to be in the community and do things for the community, that is what I feel true research is building those bridges, building those coalitions, and understanding and interacting and engaging with community in a true and meaningful way. And so these are just some examples of that. So my nonprofit is also partnered with the Arizona Cardinals. And so these are the games, and you could come to our website, and if you purchase tickets, the Arizona Cardinals gives back a check to our nonprofit for our efforts as well. Currently, I also sit on the board for L'Oreal's Diversity and Inclusion. And L'Oreal has been an amazing partner. Not only do I sit on the board, but they're also partnered with my nonprofit. And with that, they gave us grant funding to provide free mental health services via telehealth. And so, especially to address the missing and murdered Indigenous women epidemic that is here in North America, both in US and Canada. And so we will be start out pushing this initiative within the next couple of weeks to provide telehealth nationwide for Native persons and their families who have been impacted by MMIW issues. NFL. So we're also now partnered with the NFL, specifically the NFL Alumni Association. And so last week was Super Bowl. My voice is kind of gone because I went to so many NFL related events. And we also hosted 3 of our own that were NFL alumni sanctioned. And one of our events is the Women in Sports Luncheon. And these were dynamic women who are all in the world of sports. We have Olympians and professional athletes, and it's really nice to bring also Native American women to the table and be recognized. So we have 2 Native women. One is a professional boxer who will be vying for the boxing Olympics, and the other was in the World Games, and she medaled in hammer throwing this past summer. So we want to continue to do more work with them to bring more light to the missing and murdered Indigenous women epidemic, and to really utilize these resources again to help bring these partnerships and hope back into the community. We also hosted our first ever fundraiser gala, and we had Dorian. We hosted a cocktail reception for him. Who watches Reservation Dogs? Okay. Do you guys like the show? Yeah. Do you remember the 2 brothers? Okay, Little Mike and Funny Bone. So they came and they performed at our gala, which is pretty cool. And then Redbone. Who's familiar with the band Redbone? They're oldie but goodie. Guardians of the Galaxy. The first song when the actor is playing, and I can't sing Worth the Dawn. That's why I never became an entertainer. But come and get your love. That. So Redbone performed as well, and it was just a way to bring this visibility during the NFL in conjunction with the NFL Alumni Association to have a huge presence and celebrate Native excellence, but also celebrate our allyship as well in terms of like all those who are helping support our community in different ways. And so this was an amazing event, and we will now be working and having these events at every Super Bowl moving forward in every city. So now we have developed a very strong partnership with the NFL Alumni Association moving forward, which we're really excited about. So how I kind of brought the story of basketball and how basketball was my safe haven. It was in a way, my ticket out the door to go advance my education. So basketball was my first love. I dedicated all my time to it when I was younger. I did play some college basketball. And so this is where the love of my sports comes in, but it's all connected to health. Like, you know, people like see sports and they see fashion and they see this and then research and people think like they're so siloed and there's no connection. How can you work with the NFL and then be a researcher and a scientist? How can you do this? But it's possible because I'm doing it now. I have found a way to bridge all these amazing things together. But the number one premise comes back down to community, and it comes back down to health equity and using these different platforms. So I am the first Native American to own a professional basketball team. Now I own 2. They're located in the country of Mexico. One is called Rosarito Sun. The other is called Tecate Magic. We are FIBA recognized and accredited basketball league. FIBA recognized means it's a validated international professional league. And it means when we're in season, you can go to any sports book, Caesars, MGM, FanDuel, and you can bet on my teams. So just FYI. So, and I got into this whole cool world of being a sports owner. I'm the only female in the entire country of Mexico that has any professional sports ownership. And now because of that, I do some work with the NBA, Rucker Park in Harlem, with the Pro-Am Basketball League, I sit on their advisory committee. We do some work with the NCAA in terms of recruitment and pipelining. So we'll be doing some basketball camps now in association with the NBA as we move forward. So, and the whole premise of me is being the first Native American women professional team owner. The goal is to bring new visibility and inclusion to all communities who have been historically underrepresented in sports platforms to promote sports equity. And we come back to that word equity. And so I want to lead with all comes back down to equity, health equity. Where's my amazing mark at? Okay, last thing.
Yes, Crystal. So we are right at time, but if you are patient enough to stay a little behind, I think we're about to end, but hopefully, you know, if you can stay after, we also have a room at SEMO to continue our conversation. So, and thank you for coming.
I'm just gonna play one more video. Really quick. Thank you. So that was my last thing I want to share is I developed the first Native American / Indigenous healthcare app that we can do access to telehealth services. We can self-monitor our health. We can have the ability to acquire data. We have a survey aspect on there, so we can contract with different researchers. If they wanted to do a study, we have a way to put it on the app and to allocate participants for the app for the studies. We also have all the Indian Health Service hospitals listed, all the urban health clinics on there as well, all the information for those. And then now we're starting this. This is still in the final stages of beta testing. I've been working on this app since 2020. And so we're gonna push it out in about a couple of weeks. So you guys got some new knowledge that hasn't yet we haven't yet publicly disseminated. And our next phase of the app will be to integrate language revitalization. Use a lot of, starting with the Navajo tribal language is to have English and Navajo version of biological and physiological and anatomy parts, I'm sorry, on the app. So that's a way to help re-engage language revitalization in the context of health with the app. So we're pretty excited that this app is forthcoming. But I know we're out of time, so I just want to say thank you to everyone. And I truly am honored to be here. And thank you, Dr. J. Lee, for having me here. Appreciate it.
Thank you, Crystal. Lucy, do we have, I know we're out of time, but do we have room for questions? Okay, all right. Well, thank you all. So as I mentioned, if you want to continue our conversation with Dr. Crystal Lee, we have a conference room set up at Summer, so you can come talk to us after and then we can continue our conversation. So thank you all so much.
everyone.